Hi there, here we are with patient Peter. Peter just came in today after a 6-year hiatus from the office here. We did one MaxHarvest hair transplant 6 years ago. And welcome back, thank you for being here.
Nice to be here, doctor.
Excellent, and I really appreciate you doing this video.
Thank you.
Now, so Peter is what's called a class 6, where on the top of his head, he pretty much wouldn't have any hair if he didn't have the hair transplant that we did 6 years ago. How was the process for you?
It was excellent. I'm very pleased with it. You did a great job. You know, the recovery was awesome, and the hair, you can see it's very good.
So now, what do your family and friends think?
You know, they think it's awesome. They knew something different, but they couldn't tell.
They could tell.
Yes, but I think, you know, they knew I had done something.
Okay.
Yeah.
And now, you were telling me about your hairdresser. Can you tell me about that?
Yes, you know, my hairdresser, I mentioned to him last week that I'm going to have a transplant, and never knew that I had one.
Wow.
Yes.
That's
and,
awesome.
Didn't recognize it, didn't make any comments. He just thought, you know, it was a great idea to do this. Yes,
that's excellent.
Yes.
And so after the procedure, no pain, everything went well during the process for you?
Yeah, the process was great. You know, I was here in Florida for a few days, and I enjoyed my vacation. It was great.
Okay.
Yeah.
And
very little pain.
Yeah, very little pain.
Yeah.
Excellent. And now, so you're back for more hair?
Yes.
Okay, and so this is pretty typical what will happen when we do a hair transplant. There's only so much we can accomplish. What we always want to do is we want to start up front, recreate that nice natural looking hairline, reframe the face, and can I have you just kind of tuck your chin down just a little bit for me? And then just basically fill in that whole top area as far back as we can go. In many cases we're unable to get all the way to the crown from a procedure, and what we're going to do today is focus on filling in his crown. Patients always kind of want to see what it looks like when you put the comb through there. It's his hair. It's all nice and natural and soft, and you know, if you look at the hairline, it's just feathery and just natural the way he had it when he was had his own natural hair. What I'd like to do is show the suture line while I have you here. I'm going to just spin you around here for a second, please. And I'm going to kind of tip your head back just for a second because I want to show actually the other way. So this is what we'll see where we'll fill the whole thing, and then the people always say, well, what happens to the back? Well, we create the back so it looks like a natural appearance of a crown. So when he had his hair, this was pretty much empty of hair, or bald we could say, and then what we do is go as far as we can get it, and then this is created with all grafts. This is all grafted so it looks nice and natural like a crown. Now I'm going to show you what the suture line looks like. And I have not looked at this yet. Let's see what this looks like. Okay. So this right here is the suture line. If you can see that little fine trace line. He healed absolutely amazing. So that's the, can't even show it. Look, you healed amazing. Right there. Can you see that little trace line? And I'm going to just kind of take it all the way around. Excellent, excellent healing. Excellent healing. Look at that. Perfect. And the whole way around, let's just kind of show the whole suture line. Look at that. I mean, he could literally shave his head and you wouldn't see the suture line. I can barely find it myself. But that's it right there. I'm going to put my comb over it because you can't see it otherwise. You did great, Peter.
Thank you.
I mean, it's literally you can't even find it.
I think it was you, doctor, who did great.
Wow, thank you. It's perfect, absolutely perfect. So today, what we're going to be doing is we're going to maybe fine tune the hairline a little bit, but mostly focus on making the crown disappear. And then he's back in business, just like he was when he was a younger man with hair, I should say.
That's all right.
Anything you would say to people who are potentially thinking about having a procedure?
I think the procedure is very simple, very good. I was afraid at first, you know, doing it, and I almost walked out.
Yes, you had reservations.
If you remember, yes,
yeah,
but if I can tell anyone, you know, how simple it is, and they can call me as well.
Awesome.
Yeah,
you know, you're a perfect example of that, and that's normal. Patients are obviously, they're apprehensive because they don't know what to expect, just the same as you. And you saw how easy it was, and now you see the results.
Well, I'm back.
And you sent us a lot of your friends too, right?
Yes, I had several of my friends came and did the procedure. They enjoyed it. A couple of them came back, I think, for a second procedure.
Well, we really appreciate that.
Yeah, they're very happy. They're very satisfied, and that's why I'm back.
Thank you very much.
Thank you, doctor.
We're going to do another great job for
Good
you.
to see you as well. Yes.